I'm Carolyn. I'm a personal trainer and I specialise in working with people who have had cancer. This is the third film in a little series aimed at helping women to recover their mobility and upper body strength after breast cancer surgery. It's intended for anybody who has had lumpectomy, wide local excision and mastectomy and axillary surgery, but not for women who've had reconstruction surgery, because it's different exercises that we need to do for that. So, and this is the third in a little series. If you haven't looked at the other two films first, please do, because they provide the background and a kind of safe run-up to what we're now going to do, which is to use weights post-surgery. So do the first ones first, and they do act, even on the day, as a little warm-up, as preparation for what we're going to do. So I'm at week 6 post-surgery, and certainly what my physiotherapist told me was that it's perfectly safe to go back to normal activities and light weight training after 6 weeks. For me, I use weights all the time, so this is me going back to what would be light for me. I would absolutely encourage anybody to do strength training after surgery. Do strength training for life anyway, it's so helpful. But specifically after breast cancer surgery, round about week 6, a light resistance is deemed safe. Can be a tin of beans. It doesn't have to be heavy. If 500 grams, if half a kilo is enough for you to feel that you have something to force against as you move, then it's plenty. I'm pretty strong and I'm using 1.5 kilo weights, but start light, absolutely always start light, and then we can build up. It's much easier than dealing with injury through overdoing it. So I'm assuming you've looked at the film before this, where we went through all the movements that we're going to do, but we're now going to add weights. So we're going to take our hand weight from here and we're going to push straight out. Okay, so I'm pushing the weight forward nice and gently. We're going to do 10 or so of these. You can do this lying down, by the way, if you prefer to. Lie flat, push up, same exercise, but just gravity is slightly different. Okay, and as I say, start light with these weights, please. No heroics. Nothing should hurt, by the way. This should not hurt. If it does, we go back, we rest, and then we start without the weights and slowly build up. From there, we're going to take the weights so that drop them down by your hips, and again, gently up to shoulder height. Try and sit tall or stand tall. Try and keep your back long, raising the arms gently. Expect to be stronger in one side than the other, regardless of surgery. Actually, most people are stronger on one side than the other, but surgery may well have amplified any changes, any differences rather, in strength. Okay, from here we're going to bring the weights to shoulder height. We're going to sit tall and we're going to send them straight up into a shoulder press. Don't be alarmed if you feel movement. I can certainly feel just a little, I wouldn't even go as far as tug, but I'm aware of my chest muscles on the surgery side supporting me as I do this. Excellent. And then from here we're going to drop the weights in front of us and with a straight arm bring them up. This one's quite hard. It's quite hard anyway. So if you need a lighter weight, if you need no weight, by all means doing it. But what we're doing, we're not bending the elbows, we're bringing the arms up straight in front. Okay. In the last film we did a press up against a wall, and we're going to expand that. So you're standing facing a wall, up on tiptoes, and your hands are shoulder width and shoulder height. We dip into the wall and come back out with no movement through the hips. The difference, if you've been doing this for 2 or 3 weeks anyway, is that what you can now afford to do is take a tiny step further back, drop your hands down correspondingly so they're still at shoulder height, and then we dip in and dip out. Obviously beyond then, and beyond now, what we may well then look to do is press up against the floor, press up on the floor on the knees. Perhaps some people will do it in a box position or with their feet kicked up behind them. Lots of women struggle with press-ups, but the place to start definitely is by a wall, and then gradually bringing your hands lower and lower whilst still able to dip in and dip out. You're going to take the weights really wide as you reasonably can, and then pull them in. So there isn't any movement through my elbows. They're not locked, but this is all about, imagine having massive wings, flapping them, and you're here, you're moving your pectoral muscles in and out. Excellent. Again, we don't need to do too many of these. With all of these exercises, I'd start with 6 or 8, but with a weight that is completely reasonable, and then work up, so you're doing 10, 12, then move up weights progressively. The absolute secret to strength training generally is to be consistent, to start low and to very progressively work up, and this is amplified. It's so much more so when you're doing work after surgery. We have to start low, you have to stick at it, and you have to build. But if you do, if you can, it'll pay off. Okay, so it's easy for me to demonstrate standing. You're bringing your dumbbells so they are close towards each other. My thumbs would reach, but actually the little end of the dumbbells touch each other. I'm drawing my elbows up first. I'm bringing the band, sorry, not the band, the dumbbell. I use bands a lot. Up towards my armpits. Now this feels different because there's movement through the rib. If any of you are still sore, these ribs, you know, the ribs down here rather than further. If any of you are still sore, or if movement is still coming back, if feeling is still coming back around the ribs, you may well be aware of it now. Cool. And then from there, we're going to use the triceps. So, quite a difficult one this, and if it's too much for you with the weight, then by all means drop it back for now. But what we're doing is we're bringing the weight behind the head. This part of the arm is staying stationary, and we're straightening the arm right up above the head. Good stuff. Now, if you are right-handed and your surgery was on your left-hand side, or the vice versa, something that I observe loads is that the dominant side, if the dominant side hasn't had surgery, you will use your stronger arm so much more. So deliberately, I'm doing this on both arms, although I'm right-handed, my right arm is much stronger. But what I'm trying to do is maintain balance. So I'm asking the same thing of both arms, just to make sure that we remain aware of any difference so that we can work towards rectifying it, if that makes sense. One trick I learned, so in that scenario, you're right-handed, your surgery was on the left. One thing that I have worked, something that I've managed to do quite successfully, is something like this. We will start on the left-hand side and do a set of exercises on the weaker side. We'll then do it on the right-hand side, same number, but then come back to the surgery side and repeat the set just on that side. Because what that means is that you ask your weaker side to do more work, just gradually, just steadily. Ask your weaker side to do a little bit more work to see whether we can help it to just catch up a little bit with the stronger side, because chances are, if you're a right-hander, you will, and your surgery was on your left side, you will have used your left arm much less in the time since surgery. I know I have. I'm not reaching up to get things off tall shelves with this arm. I wouldn't have anyway, but even more so. So start on the weaker side, move to the second side, repeat on the weaker side if you're trying to rebalance. Okay, we have bicep curls here. So elbows are staying in in by the ribs in the waist, and we are lifting the dumbbells gently up towards the shoulders. Some people will do this, but it's not. We're trying to isolate the movement, so we're just using these muscles in the upper arm. And I've got this exercise in for a couple of reasons. Firstly, because it's one that is used widely to help with training after lymphedema, or if you have a risk of lymphedema, but also because a lot of women are thinking about body image reasonably, and they're thinking about how they look in tops. I've known this. You know, you think about what do various tops look like, and so this is actually a bit of a vanity exercise as well, because you know, if you get some nice shape on your bicep, a lot of women would say that they like that look. Nobody necessarily wants to be really bulky, but to just start to add a little bit of muscle here on the arm, a lot of people find desirable, is that the right word, for themselves. Anyway, we flip the weight to here, and now we bring it up. Works the biceps differently, works the lower arm a little bit as well. Doing a set there. And then finally we're going to flip the weight to here, so the knuckles are on top. And again, it's more difficult, this one. This again asks for a little bit more strength in, or it's building strength in your lower arm. Good. 2 more. We're going to reach right up, if that's a reasonable ask, and then we're going to bring the weights down to shoulder height and push up. So lower them gently, push. But this is wide. So we've already done one where they're coming straight up. This is wider. Feel it under the armpit, and if there's still any restriction actually under the armpit, might well be more apparent now. Just work with what's comfortable. Last exercise is a big ask. If this isn't right for you today, then don't do it. And if you want to do it without the weights, by all means do, but it's just asking for more and more from our strength. So my elbows are quite close together, and I'm dropping them behind my head. I'm not moving my upper arm, but the weights, my fists are coming up above my head. And if that feels comfortable, if it does, we could also bring this down. So to bring the weight right over the head and down. And if you can do that and sit tall, hold your belly, you'll feel your belly muscles have to work to stabilise you. But as I say, I deliberately leave this to the end of the routine because it's hard. And so the last thing we want to do is hurt anybody post-surgery. So that's a little routine. What is it? 2, 4, 6, 8, 12 exercises that if you can build strength gently over a period of a few weeks and consistently, should help to rebuild body strength after breast surgery.